they're close to getting ready to be taking their, dietetic license once they finish their internship to become registered dietitians. So they finished all their coursework. So I've invited them to listen in and learn a little about this. And, if we start running out of time for questions, I told them they could chime in and help on the chat to answer some questions as well. So
Great.
yeah, we'll see how it goes, but I'd rather do them live and not wait.
Absolutely. Let's do it that way. So everyone, sit back, enjoy, listen, and then I'll come back to tell you what's going to happen next at the end of the hour. Go ahead, Annie.
All right. Well, thank you. Greetings from warm Las Vegas. I am at the University of Nevada, Reno, where it's very cold, but we are located down here in Las Vegas, and it's, I hate to tell you, it's running 65 to 70. So it's a little bit far from the university, but we love it down here. So, so today we're going to be talking about general. So most of what we're talking about today applies to men and women. Next week, we're going to focus more on specifically how this whole issue begins to be even more complicated with women and what we need to be looking at more specifically with women. But we're kind of starting with the broad, and then we're going to go narrow after that. But before I kind of start out, I'd like to have you throw into the chat just to get an idea here of, let me pull up my next slide and let's see how you use it. Oh, let me share my screen first. Okay. All right, can you see my full screen? Okay. So here's the first slide, and I want you to just put in the chat. First of all, according to drugabuse.com, 40 to 60% of individuals relapse within 30 days of leaving an inpatient drug and alcohol treatment center, and up to 85% will relapse within the first year. There's probably not anything that you guys don't know. But my question is, from an agency standpoint, which seems like most of you are, why does this happen? Like, what are the predominant barriers that you see that derail a successful treatment plan? And just type them in the chat. It could be one word, it could be a sentence, whatever. I just want to know, yeah, like your gut reaction. I don't need to know the science. I know what the science says, but I want to hear from you guys. Like, the science sometimes is more broadly and says, well, yeah, but what happens here is different. So just what are those things? Why do you think that people come in, you're doing your treatment, all of a sudden a week in, they're gone? Just throw them in the chat, and maybe Rebecca, you could just sort of.
Yeah, we're seeing a lot of lacking support, not enough follow-up. Housing is a big issue. Family, returning to family and relationships is an issue. A lack of goal or plans. The shock of losing the structure within a treatment facility. Brain chemistry. Sometimes it's just too much to cope with. Sometimes not enough accountability. Stress. Housing comes up again. Transportation. And loneliness. A lot of your friends have changed or maybe aren't a healthy choice.
Yeah. Those are great answers. I think they kind of go along with what the science says, but I would sum those all as like a lot of that is basic needs, right? Food, housing, social, like I can't just do this alone. I need to be connected. I need to be connected to people. That's a basic need. Just structure. And if you just kind of sum those up, people aren't relapsing for any reasons other than they're just don't have their basic needs yet. And so those are jumping out in front of my ability to recover. So this is a modified version. I kind of modified from Dr. Mellinis, who published a paper, but also I've looked at hundreds of websites over the last couple of years, and I see that almost every treatment center posts some of this stuff on their website. So I know that people are saying, yeah, I like this. And he just did a really nice job of talking about relapse and why it happens. And basically, there's 3 reasons that people relapse in the first 30 or first 3 days. First 30 days, 3 categories of relapse, and they're emotional, mental, and physical. And emotional is the essence. Basically, what they're saying is what's involved with emotional is the essence of self-care. So yes, it's all basic needs, but this first one is self-care. If I don't have self-care, I can't even move forward. So it really doesn't matter if you give me this perfect treatment plan, and it's excellent, and it's been studied, and people recover, and it works, and it's beautiful, but I can't use it. So it's like you give me this tool, and I put it in my bag, and I carry it out the door because I can't use it because I'm not ready yet. I can't open the bag because my basic needs aren't met. And some of those involve withdrawal symptoms, which cause people to feel, anxious and nauseous and physical weakness. They have cravings. They have post-acute withdrawal syndrome, which I'll talk about in a second. Well, actually, let me run there and I'll run back. This is post-acute withdrawal symptom. It's mostly physical symptoms. And this is what is believed to be one of the primary things that happens. So a person goes through detox, quick withdrawal, and then the next thing that happens is they go through this post-acute right following their detox. And so now it's withdrawal that follows that. And so look at the things. They have mood swings, anxiety, they feel good and they don't feel good. I have energy, I don't have energy, I'm irritable, low levels of enthusiasm, I can't concentrate, I can't sleep. These are basic needs. And so if they can't function under these, then they're not able to jump in and fully give you the attention and put out their best foot forward to utilize the recovery skills that they're needing. And the need for self-care, varies from person to person. So one of the main goals in this stage is to help the person understand what self-care means for them, why is it important, and what do we need, such as sleep and hygiene, a healthy diet, and emotional self-care. Give yourself some space, be kind to yourself, and give themselves permission to have fun because they don't think they should be having fun, and nothing feels fun. And we'll talk about that. But so that's emotional stage. It's withdrawal, it's post-acute withdrawal, emotional regulation, isolation. You don't want too much time to be alone with your thoughts, but you want time to really process what's going on. And then self-care. This is basic hygiene, stress relief, eating healthy, sleeping. And so that's the first stage. And then what he says is most people will actually relapse right in the middle of this because they can't put their best foot forward. They can't, they just can't focus. And then if they make it through that first stage, then they relapse mentally. That's the second stage of relapse. And mental is basically the battle of getting sober. So my needs aren't really being met much emotionally, but now I have a problem because I lack the motivation and meaning. And then what happens is they'll turn around and romanticize their sort of past addiction, because you know what? It wasn't the best. Maybe my girlfriend down the street is not the best person because she uses drugs still, but she loves my kids and she thinks the world of me. And so I'm going to call her to help me out here. So all of a sudden, everything in the past starts to look better than now because now my needs aren't being met. Relationships, and then they begin to, that's when this whole battle starts to unfold. They start going places, people that they used to, or they probably shouldn't. Relationships, overconfidence, they start thinking, well, maybe my problem's not as bad as I thought it was. They start missing meetings, or if they're there, they're bored, they're not paying attention. And so then everything changes, and now it's emotional battle. I'm going to try to stay here, and then, pretty soon, then they give up. And then the last step in the process would be the physical addiction. And that's where they actually physically, and I think that even happens starting with a cross addiction, like something else, and then that leads to a lapse. And then that, then I feel I have to start over and I feel like a failure, and then that leads to relapse. But it's very interesting that he really feels that you don't just relapse. You don't just, all of a sudden feel like you don't need it anymore. It's a process of starting with this emotionally you relapse, and then mentally you relapse, and then finally physically you relapse. Now, where does this bring me to this conversation? Well, healthy living, and I like to say sustainable recovery, involves teaching these kinds of things and working with clients to do these kinds of things. And that will help that. So like addressing their physical cravings, which generally come from poor diet quality or nutrient deficiency or sugar cravings or nicotine cravings or energy cravings for energy products and Red Bull and that and such. Those are physical needs, but those cause these physical cravings. The psychosocial obstacles, those are negative self-esteem, body dissatisfaction, a lot of those things that we'll talk about next week. Mood swings, and that's why they come, and they're bored, they're not learning anything, not because you don't have anything important to say, because they're not able to absorb it and do something with it. Lack of focus and concentration because they're low energy, they're fatigued, they're tired, they're sedentary. They're, again, nutrient deficiency. And then, of course, you have your biological, which could be related to things that you are much more comfortable with in terms of cultural obstacles, hormonal, past history, trauma, domestic violence, sexual assault, those kinds of things that now they have to bring to the table. And then the last one is interpersonal stress. And those are some of the things you mentioned. If they're having trouble going to a job because they got to take care of kids, they don't have any money, they don't have housing, they don't have transportation, they lack life skills, they're trying to get relationships back with their children, etc. So I just wanted to do that very quickly and just spend a few minutes to really talk about, what is happening with relapse. It's not as simple. It's all those things that you guys put in the chat, but it kind of focuses around what I really believe is these 3 steps, how that happens. And it starts with emotional relapse. If they're looking bored in your class, they're looking bored as they're sitting there. They may not be bored. It just looks like they don't care. They're just sitting there. Honestly, they could be emotionally already relapsing. And that's a good sign that we need to kind of step in. So there's 2 areas that I'm going to address today, and one probably 75% of the time, and then I'm going to mention physical activity, even though I'm super passionate about that. And as a fellow of the American College of Sports Medicine, I'm very, very passionate about the role that physical activity plays. But I'm going to focus mostly on the nutrition today, and then we'll see how much time we have. There's a couple of things that I want you to know about physical activity that I think could be extremely powerful in terms of what you could do and what difference it would make. But let's start with the nutrition. And again, if you have a question, you can either, just turn off your mic and kind of jump in there, wave your hand so I see that you're trying to say something, or put it in the chat. And Rebecca or one of my students can chime in and interrupt me and say, hey, there's a question, or answer it or whatever. So but we're going to start with nutrition. And these are the things that we need to talk about in terms of nutrition nutrition is the nutrients that our bodies need. We need to understand deficiencies while using drugs and during treatment, and the role that the diet plays in successful recovery. And I kind of think of it as a paradox, because here's the irony of nutrition, is that people that have substance use disorder, while they're using drugs, they develop very, very poor nutrition habits. And when they come into treatment, those poor nutrition affects their ability to recover. So they have poor nutrition coming in, but if they don't have good nutrition going out, they're not going to recover and they're going to go right back. And so it's kind of a vicious cycle. And I think one of the most dangerous things that we do as providers in the treatment arena is that we say, well, I want to focus on sobriety and some of these other flagrant issues, right? I got to get them I got to get them a place to live. I got to make sure they're working. I got to, cut their ties with so-and-so. I got to make sure they're dropping their UAs. I got to make sure they're coming to group. Like these are, and then when they establish, phase 1 or phase 2, phase 3, then we'll start allowing them sometimes to take, health classes or nutrition or do an exercise. And that becomes sort of the reward. If you do really well in treatment, then we can do some of these things, and not realizing that we need to reverse that. And I think by the end of today that you'll really understand this. But the paradox is that drug use leads to poor nutrition, and poor nutrition prevents recovery from drug use. Recovery from drug use. So we have to address them at the same time, and we have to dig in at least and start addressing nutrition early on. Here is the impact of how substance use affects nutrition. Poor lifestyles that they have a lot of times, even ones that feel like, oh, I'm a functional one, and I eat yogurt and I exercise and I take calcium tablets every day. I brush my teeth, so that's why my teeth aren't falling out. Well, it doesn't matter. Sometimes it's malnutrition. Sometimes it's nutritional deficiencies, but sometimes they don't come from malnutrition. Sometimes nutritional deficiencies come from the fact that the body can know, because a drug, this, if you go to the doctor and your doctor gives you a certain medication, the doctor says, oh, I'm going to have to give you this because this medication also causes this, right? So illicit medications do the same thing. And for instance, stimulant use prevents the absorption of calcium, which is why they lose their hair and they lose their teeth, because it doesn't matter how much calcium they take. If the drug is preventing the absorption of it, it doesn't really matter. So malnutrition, nutritional deficiencies, there's a preference for poor diet quality foods. Diet quality meaning how good the foods are, how healthy they are. And there's a preference for poor ones, the easy ones, the bingey ones, and we'll see why that is. But that binging, they want to binge because they've got these ups and downs with the sugar, with their metabolism. They develop disordered eating behavior, and then of course compromised GI health is also a really big part of it. So substance use leads to chronic nutrition impairment, resulting in serious damage to the liver and the brain. Sorry, I've had a cold, which reinforces the craving for more drugs and alcohol and perpetuates that psychological aspect of addiction. So I just want to look at these at a glance. So if you're looking at poor physiological health and how, and the last one, this one tells us how substance use harms my nutrition. But let's look at how nutrition can also lead to poor nutritional status, or how psychological health can lead to poor nutritional status. How does nutrition affect my recovery? That's the opposite side of that. So let's just look at this for a second. This is really, really important for you to understand and think about clients that are coming in. When a person in recovery feels unwell, we use the term unwell, it's very, very difficult, and I kind of said this before, to maintain their treatment goals, to listen and have you help them with their treatment goals because they don't feel good. So for example, think about when you don't feel well, what do? COVID's going around, everybody knows, imagine, and some of you probably feeling this today, I'm feeling this a little today. You come here, you're like, oh, I don't feel well, but I need the CEUs. I might be interested in this topic. I'd like to sit in, but I just don't feel well. You go off camera, right? And you just you might be laying down at home, who knows, right? Because you don't feel good. And you're not going to be in the camera saying, I'm ready to learn, I want to participate, because you don't feel good. This is probably many, if not most, if not all clients when they first come into treatment. And it's not just because they have attitude. I'm sure they can develop attitude or have that. It's because they don't feel good. Some of them are thinking to themselves, where am I going to get my next meal? I haven't even been able to apply for, for EBT or for, SNAP or Medicaid or whatever. I don't even know how I'm going to eat, right? Or they might just be thinking, I just don't feel good. I feel tired. I can't sleep. I haven't slept for 3 nights, and I'm sitting here trying to act like I care to be here. And if they feel unwell, they're going to focus not on what you're talking about. They're going to focus on what doesn't feel good. And I know that you know that, because when you don't feel well, that's what you focus on. You're like, oh, my head hurts, and I can't wait. As soon as this is over, I'm gonna go lay down and take a nap, right? But then you have to add that they're a court order to be there. So this can directly affect their mental health. And so you can see, if we flip that and they feel well, they're eating better, they're sleeping better, they're doing all these things physically to make them more well, more healthy. Now they can focus. Now they're not so tired. Now they have higher energy. They're sleeping better at night, and it makes a huge difference. And they're going to function at a much higher level during the treatment than they otherwise would. Does that make sense? I don't see many head nods from my off cameras. You could throw me one of these once in a while. Okay. So here's a study, and this is really cool study, and I like to throw studies out. I'm only going to tell you about a couple of them. The rest of them I'll just say, here's what they found, just so you have that, and I can send you these slides so you have the data. But this is a really, really, to me, a really seminal study. They looked at, it kind of tells us why malnutrition and electrolyte imbalance and nutrition deficiencies rise to the top early on in treatment. So they used a subjective global assessment. I don't know if you're familiar with that. And there were 67 patients, most of them male, 19 female, admitted to a hospital detox unit, 49 alcohol dependent, which was 73%, and then the rest, all of these things. They looked at their diet quality score. Okay, so what was the quality of the nutrition they were getting? Let's put it that way. And they did blood tests on them. Okay. The results were that all of them had very poor appetite and diet quality. Their nutrition was horrible. Their appetites were just messed up. Too low, too high. There was nothing normal about it. 88% required nutritional guidance, which could generally only come from medical nutrition therapy. 50% were clinically deficient in minerals, with the top one being vitamin A, and then iron, potassium, and then vitamin C, in that order. Those were the minerals that they were deficient in. 50%, half of them were clinically deficient. And then 24% of them were diagnosed with malnutrition, which means they would potentially even have to be hospitalized. This is a pretty significant. If you try to imagine that this is what your clients look like when they're coming in, and you wonder why they can't pay attention. It's hard to pay attention when you don't eat breakfast, right? When you haven't had breakfast or lunch, and all of a sudden you're like, okay, I'm getting hangry or whatever. So why are they nutrition deficient? There's a couple reasons, and I'll just throw them out. One of them is because the nutrients are used during the detox process. So they're used to detoxify the body from drugs and alcohol. So some of them are lost right in the middle of the detox. Sorry, my phone was going off. Secondly, a lot of them are throwing up from detox. They have diarrhea, they have digestive problems. So they're losing any nutrients that they might eat are being lost through that. They have changes in appetite. They might not be eating enough. They don't have enough money or access to good nutrition. And then the other one I mentioned earlier, that their body can't access those nutrients like calcium. So that's another reason. So, but I would encourage you to promote food, healthy food, and not supplements. I'm not saying supplements are bad. I'm just saying that, one, they're expensive. Two, you don't really know what you're getting because they're not considered a food. We'll talk about that in a minute. But also, a lot of these clients are used to the pill popping, right? That's a quick fix. All right, I took pills for pain. Now I'm going to take pills for my nutrition. Now I'm going to take pills for this. And it's just part of fueling that kind of addiction in them. So I don't really, but I will say that if a client is eating healthy and they're being physically active and they're taking care of their body and they want to take like a multivitamin or something, that's okay. Don't let them say, I think I need more of this and this and this, and I'm going to run to the store and get vitamin this, and iron or whatever. Just take a multivitamin so that they don't, mess up their system or try to play doctor to themselves and be wrong.
Hey, Annie, we do have a quick question. Jane is asking if you can talk about ammonia levels and how they contribute to a lack of attention and other effects in the body.
That's a good question. And that probably is beyond the scope of what I know. I don't know if our dietitians have studied that, but that would be more medical nutrition therapy. But if you want to email me, I will get that. Yeah. It's a good question. It's a great question. And nobody's ever asked that. So I will definitely look into that. Okay. Diet quality and mental health. Here's just another study that found that the significant impact of diet quality that we already know, when you go to the hospital and you have a chronic disease like diabetes, the whole world knows that they're going to put you on a really good, healthy diet and it's going to make change. What they're saying, this study actually looked at both of those and said that thing that happens for chronic disease extends to the high prevalence of mental illness. And so we should be doing this. They did this on, looked at this on, let me see my notes, 1,046 women between the ages of 20 and 93. And they adjusted for socioeconomic status, for education, health, behaviors, et cetera. But what they found is that a traditional dietary pattern, which is, fruits and vegetables and meat and whole grains, was associated with lower odds for major depression and anxiety disorders. Not just helping your diabetes or your heart, but actually improved depression and anxiety disorders. And vice on the reverse of that, or the flip side of that, a Western diet, which they call, it's nice that they've taken Western part of the hemisphere, the United States, and called us Western, because everything you hear about the Western is always in the negative. So, but a Western diet is processed. It's fried foods, refined grains, sugar, beer. And they found that a Western diet was associated with, it says it's a higher, but it's a more negative general mental health questionnaire. So a healthy diet is as powerful in your field as it is somebody that's treating, diabetes or heart disease, and don't underestimate the power of that. We've also found, and this by the way is a really good, she's a dietitian that's published a really nice article that I'm happy to send out. that it's very hard to find dietitians that work in this field that are really good and understand this field. So she published a really nice paper that I use some of her stuff, and it's really great. So I like to give her credit. I've never met her, but she really is interested in this. So malnutrition and mental health, they found that nutrition deficiencies can lead to depression and anxiety, which I mentioned, but also low energy. And all of these we know can be triggers for relapse. And I'll tell you what, they have done studies on this stuff, crazy stuff back, in the 50s when they didn't watch what people were doing. And they've learned a lot about how nutrition and malnutrition can affect a person's mental health. And so just to sort of sum this up, poor nutrition can impede one's ability to resist substances of abuse and recover from their health. This is what we know. It perpetuates addiction. And remember, we talked about emotional relapse and self-care as the essence of the stage of relapse. So eating poorly, binging, or not eating at all can make recovery extremely difficult because nutrition crosses all these dimensions of health. Improved, on the other hand, nutritional status can make treatment more effective while reducing drug and alcohol craving, thereby preventing relapse. So all of that is just to say, it's if you've never thought of nutrition as being something that we could really make an impact and improve treatment, and our treatment outcomes are terrible. I mean, nationally, and we just accept it. We're like, yeah, we know we're going to lose, 80% in the first year and 50% in the first month. Like that's just, if we can keep them a little bit longer, then we're doing good. But why? Let's kind of try to go down a new road. So so what do we do? There's a couple things. One is just literally get out the USDA MyPlate food groups and make them help people understand what they need to eat and focus on what they should add to their diet. I always like to say that. Don't say, stop eating this and stop eating that. That's not good for you. In all of my people that have, hundreds of people that have worked for me and done studies with me, I never let them use the word, this is good for you or this is bad for you. There's many, many reasons why those are really harmful phrases. Just say, you know what, add something healthy to your diet. Don't stress about what they're eating. Don't take away what they're eating. Start adding things to their diet. Because if you add healthy things to the diet, it's by default, there's only so much room. It's going to eventually start to, decrease some of the other. And so that's more important. And even if they don't decrease it, if you're just adding whole grains or fruits and vegetables and getting more vitamins and minerals, you're going to see change, no doubt. Okay, so, and they also did studies, especially for young families that have kids. It doesn't have to be mom or dad eating healthy. Get the kids involved. People who cook frequently at home. John Hopkins' study found that that they ate healthier and they consumed fewer calories than when they eat out. So, maybe have them do a cooking, learn how to make basic meals, cook something, prepare something. You don't even have to be cook. You can prepare a healthy meal. They've also found strong links between family meals and family cohesion, right? This is a group of people that's trying to rebuild relationships with their family. Healthy meals is a way to do that, right? You all sit down at the table and you eat, and you try new foods together and you cook together. So we basically focus on the MyPlate, eating healthier foods, and then MyPlate also spells out, if you want to get a little deeper, how much of each thing you need. But if you can just get them to start adding and making sure that their day includes all of these food groups. And I'm not going to go into these and explain these. I just want to show you that this is what we know. This is what we know, that carbohydrates is the bad guy, right? Don't eat carbs. They're bad for you. Don't eat carbs. They'll make you fat. Carbs are probably the most important macronutrient in your body. That's the brain food. That's the thing that affects your brain more than anything else that you eat. It aids in the production of serotonin, which helps people feel better, stable mood, helps them sleep better, and helps them curb food cravings. Wow. Wow. But they have to be these kinds of carbohydrates, fruits and vegetables and whole grains, not, donuts and candy, because those are not going to give them that that level. Those things are still carbohydrates, but that's going to make them go up and then crash, and then sugar high and then crash, rather than these, which will keep their sugar just up in nice steady flow and keep them feeling good.
Annie, just so you know, we've had a couple people ask for the slides, so I've just assured them that you'll send them to me and I'll get them out to everyone.
Yes, I will.
And I'm
That's
also,
why I rather have people stay connected with me and just
Yeah.
go down this road with me, and then I'll send you all these.
and I'm recording too, so I should have a link in a little while that I can share.
Okay. Dietary fat, again, you went to healthy fats, but they play a role in maintaining mental health. Limiting dietary fat can result in more depressive. So if you say, well, don't eat the fat. Yeah, you don't want to eat the saturated fats, but these good fats, like you see in the picture, if you remove those from somebody's diet, somebody starts dieting because they've gained weight, since recovery. So they're on a diet, they don't eat any fat or any carbs. You got a problem, and it's going to actually increase depressive symptoms. Polyunsaturated fats have been recommended to help reduce anxiety in people with substance use disorder. So you can see that it plays a direct role. And it's important to know that recovery is an important time to start getting these vitamins and minerals, because they are nutrient deficient. And I always like to say color matters. That's why I like this slide. Each color that you eat is going to give you different vitamin and minerals. So if all you eat is strawberries, because that's the only thing you like, you're only going to get those vitamin minerals found in red, fruits and vegetables. So try to get green and orange and yellow and white and purple and blue, and purple and blue are great for the brain as well. So I'm kind of going through these because, again, for me, this webinar is to give you this big picture, and we can dig in and I can give you more opportunities if you want. But the last part that I want to talk about in nutrition is that nutrients are critical for energy. I said that people have fatigue issues. Vitamins and minerals are necessary to metabolize food to be used as energy. And folic acid, which is a mineral, a vitamin B6 and vitamin B12 help synthesize tryptophan and serotonin. So these also help, and serotonin helps you feel better, motivation, sense of well-being. And I looked at Minnesota. I want to mention this because one of the issues with energy has to do with stimulants. And this is just looking over the last 10 years, just in Minnesota, what people are being admitted for, and methamphetamine is still on the rise. Heroin is going up, but amphetamine is still on the rise, methamphetamine. And so that is a stimulant. So the minute these people stop taking the stimulant, and I stole this from one of your Echo series, showing you the dark red shows you the counties that have the highest methamphetamine. So it means more to you, this slide, than me, but I wanted to throw it up there. But I'm just saying stimulant use causes people, when they leave treatment, to have fatigue issues. And this is a great classic study from UCLA, came out 2004, showing why people use methamphetamines. Look at this list. I need more energy to work more. I want to lose weight. I just need all energy. I need to stay awake. I need, these are things. And for men, these two stand out as being significantly more than women, to have enough energy so they can work more and for better sex. For women, the top two that stand out are weight loss and energy. These are health conditions. These are things that we can address through health, through energy. And so when they leave treatment, they use this, right? Then they stop, not leave treatment, they stop using the drug, they come into treatment. Now you have a problem, because all of this dopamine, which you're familiar with, just a quick reminder, dopamine is the mechanism of action, the primary one in stimulants. So it surges into this area. With methamphetamine and with cocaine, it actually gets trapped as well. But you have this surge of, I feel fantastic, I can do anything, I can, spin this pencil for a good hour and feel really great. Because that dopamine is really, it's just that rush of dopamine high. And I'm not going to get into this. This is all on the National Institute of Drug Abuse, but it shows you how high this dopamine can be. And methamphetamine is off the charts. You're looking at with amphetamines 1,100 versus something like smoking, which is only 250, or sex, which is 200, or a food binge, which is only 150. So we're talking about super, super high dopamine, right? So now they're in treatment. Now this is the drug user, how much dopamine you see in the system. 1 month later, this is how they feel. This is how you're getting them, subnormal. And so the time that it takes to get from 1 month abstinent to 12 months, which would return them to what's a non-drug user, is going to take time. And so what do? This is what they do. I need a Red Bull. I need some energy. I need some quick pick me up. I need some sugar. They self-medicate, and this is the worst thing that they can do. First of all, again, I'm going to repeat this. I mentioned it before, like vitamins and minerals. Energy products are not regulated by the FDA. So first of all, they don't know what they're getting, if it's even what's on the bottle is even there, because they're not regulated. They're not a food and they're not a drug. They're in between, and so they don't get regulated. But second, they can put as much caffeine as they want, and it comes straight from the plant, and it's a serious high. And if you are trying to look at these, some of these things that concentrated levels of caffeine can cause: nervousness, anxiety, irritability, blood sugar problems, dehydration, dependence. Why on earth would you give and allow this to even come into your facility, people to bring and say, hey, well, at least they're sober, they're just drinking these energy drinks? This is what's happening to their brains. Again, working completely against your treatment plan. And so that's why they've been described as a gateway drug. And there's tons and tons of studies on this. This was on adult twins, found that caffeine toxicity and intake and dependence was associated with all of these psychiatric disorders. We know this. Energy drink users have greater involvement in alcohol and other drug use and higher levels of sensation seeking, which are all of these that you see in this picture. They found that people that drink energies are high energy sensation seeking individuals compared to non. Here's another one. The frequency of energy drink use is a significant predictor of the illicit use of prescription. Do you know that college students take energy drinks to help them perform better? And yet the studies show that it causes higher stress, higher anxiety, and actually lower academic performance. So that's not the solution. And then the last thing I want to mention on nutrition is also increasing protein, because we know that all chemicals in the brain are protein-based molecules. So amino acids are the foundation of neurotransmitters like dopamine. So protein is as important as carbohydrates and fats to help that. Low dopamine can trigger someone to turn to substances to help them feel better. So you want to keep that dopamine up, and protein helps also do that. So I know we're running out of time. I just will give you a couple of things here on physical activity. This is, if you take anything away from the rest of, I only have a couple minutes. How many minutes do I have, Rebecca?
You've got about 6 minutes.
Okay. So let me show you the most important thing. These are studies compiled after 10 years of scientific review that physical activity improves in adults habitual, meaning if they exercise regularly, they can improve quality of life. They can improve depression, mood, and depressive symptoms, And acutely, meaning if you just go out and just do it today, by the end of the day, you'll be less anxious. It improves anxiety even in acute conditions. So we know that there's, and also as well as chronic conditions. But this is what I want to show you. Look at this is a study they did on over 8,000 adults, men and women. And they looked at light physical activity. They looked at moderate to vigorous. They looked at step counts. And I'm only going to show you the step count because that's all I put in the slides. But I want you to see this. This is a person who doesn't exercise at all right here. See this 0? They don't exercise at all. This is what happens when they take, say, 1,000 steps. Look at their mental health score. It improves the minute they go from 0 to something, right? 10,000 is what the CDC says everybody should get. Nobody gets that. Some people do. So we're not pushing for 10,000. That would be great. But these clients, if you can get them to do something, most people only get 5,000 to 7,000 in here, an average person. Your clients are probably getting in the neighborhood of 1,000 to 2,000 if they're not doing anything. This shows you anything in that first 5,000 has the greatest increase in mental health that there is. After that, look, it does other things for you, improves your health in many, many ways, but it doesn't have as much significant increase on mental health. If you want your clients to improve their mental health, get them to do something, anything, because otherwise depression makes them not want to be active. They're not active. That makes them more depressed, and you have that vicious cycle. So in terms of recovery, these are all the benefits. I'll just show them to you. I won't read them to you. These are the things people are looking for when they take drugs. These are the benefits of physical activity. It's powerful. It's powerful. It's also very powerful right now during COVID. It builds your immunity system. These are the added benefits as well. Look at this slide. Right now, we've been sitting for 50 minutes. This is what our brain looks like. This is your brain on sitting, as they used to say. See this green? That's all the activity you're seeing right now. If we get up and go out and take a walk for 20 minutes and come back, look at how much more green there is. Now look at this. All this yellow, all this red is all new activity in the brain. So every single thing that you do is going to make a difference in your brain activity and your mental health. Don't do it because you're trying to lose calories or you're trying to whatever. Think about the mental health with your clients. And I'm going to wrap up with this. There are gaps in treatment. Few providers address health behaviors, might even contribute to mental health conditions. If we don't address the health behaviors and left untreated, they are a trigger for relapse. There's 2 options I'm going to leave you with. One is you can hire a medical nutrition therapist, find a dietitian to come in and work with your clients. Can be expensive. I would encourage you to find a good one, and I can help you with that if you need that. But not everybody has access to those dollars. So please don't underestimate the power of group education. And there are studies after studies, this is one of them, showing you that these group educations, just doing basic nutrition education, has positive substance abuse treatment outcomes and should be included. And I would also tell you that there is federal funding available for nutrition education. There's expanded food and nutrition education program. There's CACFP, there's SNAP education. I developed a program called Healthy Steps to Freedom that I can share with you. It's in the SNAP Ed toolkit. We address all these things you see on the right. But there's federal funding. There's $400 million that goes to the 50 states every year to teach nutrition education. And there are people out there that can come in and teach using those federal funds. So just know that there are options available out there. I just trained a group of 10, 15, Rebecca could tell you, folks that are nutrition educators in Minnesota to run this program. So maybe you want to connect with those people and say, hey, can you come in and teach this program? They probably have the they're using that federal funding, and they can come in and teach for you. So there's options if you don't feel like you can do it, but take advantage of it. And I hope at least today that you really start to understand the role that this can play and the positive outcomes that can be associated with this. So sorry I went so fast, but I guess there was a lot to cover.
No, thank you so much, Annie. Well, and this isn't it, right? We're lucky to have you again next month. Annie will be with us again on the 17th of February, and she'll be continuing the conversation. And it will also, I think, your target audience, the demographic we're going to focus on is working with women.
Yeah,
so
because this problem goes more with women, and so I want to go down what additional things do we have to look at for women.
That's great. Thank you so much. So I will get the slides to everyone. I will try to get the recording link. That takes me a little bit to convert, but I can do it. You're going to get an evaluation survey, and please take time to complete it. The last question is whether you need a CE certificate, attendance certificate, so that you can use it for your professional development. So you want to be sure to step up and do that. And I want to introduce a colleague at this point. Zora, could you maybe unmute and kind of say something so that you'll come to the top of the huge list of folks that we've got here?
Can you hear me?
Yes, there's Zora. Zora Darcourt is a colleague of mine at Wayside Recovery Center, and she will be your host next time we meet, which is in February. My time at Wayside has come to an end, and I will be leaving the organization at the end of the month. And so I want to just say thank you to everyone who's participated. I want to say welcome to Zora, who will be stepping in and taking care of you folks from now on. And I guess that's it. It's been an honor to be here and to start this learning community. And I really appreciate your participation and your dedication to being the best you can be. So, and the work you do, for sure, the work you do, it's so important. I think that's it. We've got 4 minutes left. Does anyone have a quick question or a comment they'd like to share while we have Annie with us? All right. Well, hey, we finished early. We're so excited to have you here. I hope you come next February 17th and watch for your evaluation survey. And thank you for letting me serve you for all these years. Bye-bye. All right, I'm going to go ahead and close things out. Annie, thank you so much, and I'll watch.
Okay, I was just reading the chats. If there's any way to save them, that would be great, but otherwise,
I'm saving them.
Okay.